Good afternoon, everyone, and welcome to Rare Within Rare, a community conversation. I'm Siri Vaith, Executive Director of the Cystic Fibrosis Research Institute, CFRI, and on behalf of CFRI, as well as the National Organization of African Americans with Cystic Fibrosis, and on behalf of members of CFRI's Diversity and Inclusion Advisory Committee, it is my pleasure and honor to welcome you all here today. Today's webinar is part of CFRI's Faces of CF Diversity and Inclusion program. CFRI is committed to inclusion, justice, and equity for all community members, and our mission is entirely grounded in principles of openness and respect so as to address the multifaceted needs of our diverse CF community. Despite the fact that CF occurs in every race and ethnicity, there remains a misperception, both in the general public and among medical care providers, that this disease only impacts people of European descent. And as a result, too many people are left undiagnosed or with a misdiagnosis, unable to benefit from CF therapies and care, to say nothing of participation in clinical trials. Today's panel is comprised of the phenomenal and phenomenally dedicated members of our CF Diversity and Inclusion Advisory Committee. These people have played a key role in CFRI's efforts to raise awareness, and I am so very honored to work with such a committed and caring group of people. I want to thank our sponsors, Vertex Pharmaceuticals, Genentech, Gilead Sciences, and Chiesi USA, who provided educational grants to support and advance this work. And again, I thank everyone who shared their stories and their experiences so honestly with the rest of us. So thank you, and it really does set the stage for the rich conversation we're going to have now. So I think to start off, what I'll ask is for the people who are here, we'll go around and introduce ourselves, and then we'll start with some questions. So Harini, would you like to jumpstart this?
Hi everyone, my name is Harini and I have two sons. They both have cystic fibrosis. The older one is now 25 and the younger one is close to 21. My older one was diagnosed at the age of 5. Obviously, we didn't know anything about it. Through various other tests, we finally figured out the CF. And once he tested positive, my younger one was tested as well, and he has they figured out that he has cystic fibrosis as well. Relatively, they are doing fine. Of course, we do have challenges here and there. But, we are hoping that they would come up with a modifier because they fall into that 10% category of, mutations. So I'm, hopeful that they'll find one soon. And I'm happy. I've been working with CFRI for the last 2 years, and I'm happy to be associated and be part of this committee. Thank you very much.
Thank you, Harini. Jeannie, how about you?
Hello, everybody. I'm Jeannie, and I have cystic fibrosis, and as do 3 of my siblings. I've been married for 35 years, and I have 3 children, all healthy. I should mention I also have 1 granddaughter. And I've had CF symptoms since I was a time of since I was a child, but as well as my siblings, my sister was much sicker than I was. And we were diagnosed in our 30s because of genetic testing, and even after genetic testing, I still had to work with a lot of different doctors to try to find the diagnosis. My sister did pass away at 42 years of age, 8 years after being diagnosed. My other 2 siblings who have CF, they're in their 60s and doing well. I do serve on the CFRI board and am on the Research Advisory Committee and Diversity Committee, and I'm very happy to be here with you today.
Thank you, Jeannie. And next we have Michelle and Terry Wright, who are helping to make this possible in partnership with the National Organization of African Americans with CF. So Michelle and Terry, please introduce yourselves.
Hi. Hello, everyone. Hi, I'm Terry Wright. I'm 59 years of age. I have cystic fibrosis. I was diagnosed just 4 years ago. Married to Michelle Wright. on the side of me. And I served on the board of diversity, and that's it.
Yes, and we're so happy to be here to be working not only with Siri and CFRI as part of diversity and inclusion, but continuing our mission as well with the National Organization of African Americans with Cystic Fibrosis. So we're just happy to be here and to continue this mission in synergy.
And it is all about partnership and working together.
Definitely.
Hema, please introduce yourself.
Hi, I'm Hema. I'm the first one on that video that you just saw. I live in Southern California. My two sons, who you saw in the movie, they are both living in Texas. One is now 29, the other one is 31. 31-year-old is the one that was diagnosed at the age of about 14. He's done pretty well. He's not let CF define himself. I do a lot of things to be involved with the CF world. He tries to keep away from some of that, but I like to be involved with this inclusion committee, the diversity inclusion committee with CFRI. And then I also help them with some advocacy. I'm also on a Vertex panel, and I also mentor for the CF Foundation program. So I try to keep involved and try to stay in touch with the CF world. But yeah, they're doing great. I'm very proud of my children.
Thank you, Hema. And Alicia.
Hello, everyone. Thank you for being here. I'm really honored to have the opportunity to share my family story with you and other insights that I've gained along the way as a caregiver. My husband, Peter, and I are from Mexico. We've lived in the United States the majority of our life, and we have two young adult sons. Mark Anthony is about to turn 20, and he has cystic fibrosis. And his older brother, Peter, is 21 and a half, and he does not have CF. However, he does carry the Delta 508 gene. And Mark Anthony was diagnosed at the age of 6. And all along, doctors thought, oh, he must have asthma, or the reason why he's constipated and has digestive issues, it could possibly be an intussusception. I mean, there were many possible ideas for what was going on with my younger son, but never did the doctors think that he could possibly have CF until finally he ended up during one of those yearly hospitalizations at Chalk Children's Hospital of Orange County. And that's when a doctor said, well, wait a minute, if you're saying these are repeated sort of incidents, he could possibly have cystic fibrosis, even though I doubt it, because that's more common in patients of European descent, and you being from Mexico probably won't be it, but we'll test him. Well, sure enough, he has CF, and since treating him with the enzymes and pulmozyme and all the other treatments, he turned around and his energy just skyrocketed. So treatment makes a huge difference. Mm-hmm.
Thank you, Alicia. And Isabel. Isa.
Thank you, Siri. It is so good to be here, and thank you for all the kind comments in the chat. So I'm Isa or Isabel. My middle name is Yuriko. My mom is from Japan. My dad is from Germany. And I've been part of the CFRI family for 30 years, 31. And I'm grateful that in a month I will turn 50. So I'm super grateful to be old. And also as a child of an immigrant family, we did not have relatives in this area. So we actually, that brought me closer to the CF community. The CF community became my family. My twin sister, Anna, and I were both diagnosed at birth. She had meconium ileus, the bowel obstruction. And actually, I'm so grateful that she had that, even though it caused much suffering. That was the first indication that perhaps this could be cystic fibrosis. And because of that, we were given the sweat test at 3 days of age and were diagnosed. So very grateful for that. And I don't know, I mentioned in the video, I don't know hardly anyone else in the US who is Asian, except for now Hyson and Meng. And we do know a number, maybe like a couple dozen CF patients in Japan. So we know that it exists. It exists all around the world, but people don't have the access that we do. Very grateful to grow up in the United States.
And I will say, I didn't mention in the intro that I have a daughter who is 26 who has cystic fibrosis. And I will say the two of the first people I met after her diagnosis were Isa and her twin sister, Anna, and how much hope they gave me. They had just returned from a trip to Japan. It was just so eye-opening. So, and I do also want to make a plug, if you want to know more about Isa and Anna's experience, they have an amazing book, The Power of Two, which was then made into a documentary film. So I recommend everybody take a look at that. It's an amazing, amazing book and film. So we'll start some questions, and I want to say I love the chats going on, but also feel free, those of you who are here with us today, to put questions in the Q&A box. But just to launch this, we decided to name this Rare Within Rare because obviously CF is a rare disease. The official, federal definition of a rare disease is one that impacts less than 200,000 people in the U.S. The latest CFF registry says around 31,000 people have been diagnosed. But I think that's the key thing that we all understand, that the operative word is diagnosed, and how many people are not yet diagnosed. So then within that rare disease, we have underrepresented groups, people of color, who are the rare within rare. So that was the impetus for this group. And so I just want to launch with the question for Terry. What has been the hardest thing for you about being rare within rare?
Siri, thanks for the question. The hardest thing been to me being rare within rare, my journey in itself. The whole journey of the 54 years of late diagnosis. And within that journey, I experienced so many different things, seeing many doctors, much pain, many surgeries. All this just been on my journey among many other things. And as well as you all know, taking a journey, you experience different things on your journey. So this whole life of cystic fibrosis on that journey just been breathtaking to me, not knowing. But that late diagnosis of 54 years, it gave me some type of relief, because at that time I was able to take some enzymes. In the past, I didn't know because of those 54 years of this stomach issue I've had, and sinus, and among other things. I just didn't know, but now knowing that there's help out there for me, even though I had the late diagnosis.
And you had the amazing experience of a physician who actually told you it seemed like you had CF. Could you share that story? It's
Right.
Heartbreaking to hear.
Right. He actually told me if I wasn't African American, he would suspect I had cystic fibrosis. And, I got to thinking just about that within itself. First time I've heard that before.
And so here you have somebody who identifies the symptoms, but really because you're Black, decided not to even do the testing to rule it out. And how many years did you go on after that, still suffering, before you had your diagnosis?
So
17.
17 years in all. 17 years. So I ended up having a piece of my pancreas removed, one of my ducts, had major surgery, gallbladder out. And I truly believe a lot of surgeries could have been prevented had I had an early diagnosis, but I didn't. So I had to kind of go through these surgeries just to kind of pamper some stuff down that was flaring up in my body. So they thought if they could remove certain things, it would solve my problems, but it really didn't. I'm still suffering, even mentally suffering, because of those 54 years of late diagnosis. And
that is an interesting, because there's the horrible physical suffering, but the emotional suffering as well, which, as for anyone with CF, obviously is an issue, but for being rare within rare, I think could be exacerbated. And Isa, do you have anything you'd like to jump in and add?
I think what I hear, first of all, Terry, thank you for sharing. And I'm so sorry. I'm so sorry you went through all of this. And just to echo the emotional impact of not being believed or not being heard. And Mao said it in the video, like even doctors sort of contesting our diagnosis can be so hurtful because we are who we are and we don't want this disease. We don't want these symptoms, but they are what they are. And then CF is such a fascinating disease in some way because it shows up in so many different ways and so many different people. So just not being believed would be one of the most painful experiences. It's happened to me too. You can't have CF, you're Japanese. I have a feeling it's happened to everybody here in the panel, but how that really hurts.
Anybody else have anything they want to add? Otherwise, I'll move to the next question. And again, this is very fluid. Oh, Harini, please.
Yeah, just reading, when my son was diagnosed, then just knowing that, okay, this is more among the European descent. And it kind of took me with my personal experience, I was always in denial for a long period of time. So that's something, if that was, it took me almost 10 years to even accept that my son has this. So I wish we were aware of it. It was not tied to any race or any ethnicity. And I think it would, for me personally, I think it would have helped me, just build that acceptance and be, though we were on top of all the treatments, but emotionally, it was really, really tough to even accept that he could have this. So, just not being tied to any ethnicity would have just kind of eased that out.
Thank you for sharing that. So, what steps can be taken to raise awareness? Harini, I'll just start with you.
I think first, it would be nice to kind of reach out to all the doctor community, especially pulmonologists, medical students, gastroenterologists, just to know that, cystic fibrosis is there in all races. Then we have to do a lot of community events, fundraising events, reaching out to, many organizations, letting them know about this condition. So that way they can reach out to all the people. And if anyone has not been diagnosed yet, they could kind of see if any of the children have any symptoms, because, early treatment is the key to this. So these would be some of the events that we do. And then we have the videos, we have flyers that we can kind of pass it out to friends, families. So these are some of the ways to go about it. Social media is another one now.
And rest of the group, feel free to jump in. Don't be shy.
Yeah,
go ahead.
Go ahead, Isabel. Go ahead.
I just want to commend CFRI for putting on these events and having the sort of, and the funders for granting the money to expand awareness and education, and also to expand the non-English awareness campaigns, because I think that's the greatest barrier in people of color of language. And so having resources, educational resources for people in different languages is so key as well.
Yeah, I echo what Isabel just said. CFRI, without CFRI, I don't think I would even know or have accepted the diagnosis that we got at his teenage years. I had come back from vacation and I started looking up on what CF was, and I couldn't understand. I didn't want to understand because there's also the taboo of dealing with nobody knowing what CF is. None of my family, nobody knew what it was. So just trying to find any information on it was very difficult to start with. But having the diagnosis, one of the things that I thought about is all these years I didn't know. And imagine all the things that I have done, so had we known a longer time ago, that awareness would have been so much better helped, and there were so many things that could have been done as far as in his childhood, the testing. There were so many markers, so many signs and symptoms that it didn't end up with any testing. So that is unfortunate. And I guess raising awareness for me, as Harini was saying, is very, very important. So putting it out to wherever with as many videos and as many flyers and information as we can. So people who have got these telltale signs, they may decide to get tested earlier, sooner the better.
Thank you, Hema. Anybody else wish to add? And thank you, Isa, for mentioning about things in other languages. And Marianela Fajardo is on our committee, who is not here today, but she talks about through her daughter Maria's diagnosis, her husband did not speak English. And there were so few resources available at that time, and she was coping with her own reaction to this diagnosis and then literally having to interpret the materials and share all that with her husband, and how challenging that was. So that is another area we really want to focus on to expand resources. And Michelle, did I see you raise your hand?
Yes, I do want to add something. I want to commend you and CFRI too. And one thing that's important for all of us individually and collectively to be an integral part of not just bringing attention to the issues, but being a part of the solutions, various solutions. And one of the things we are proud of with NOAACF is partnering with Dr. Jennifer Taylor-Kauser and actually developing a screening tool that we're in the process of releasing to patients and to providers, so to help fill that gap for those individuals that have not been diagnosed. And that's what we're trying to do, be a part of the solution and working with organizations like CFRI to bring awareness, again, from a diversity and inclusion perspective. So we just wanted to mention that we are being a part of that, but looking forward to continue working with CFRI to bring that to fruition as well. So thank you, Sari.
Thank you for all the work you do. And I'm so glad you mentioned Dr. Jennifer Taylor-Kauser, who is such a hero in the CF world and has done so much to advance awareness of diversity. And, I know you're listening, Dr. Taylor-Kauser. You step up time and time again. The fact that you're here today to hear just says so much about you. And I really love, in terms of moving forward, there's the power of our community stories, but it has to be, emerging of respected clinicians and researchers also carrying that message, so that it's a unified groundswell. And so we are very grateful to you for being a part of this. It plays such a huge role. So, shout outs. So let's talk about newborn screening. There, in the United States, every state has newborn screening with CF included on that panel. But as we know, there is no federal basic, uniformity. So there may be states that are screening just for a few mutations. And as we know, there are many, many mutations. So do you think, what are some things we could ponder for changes with newborn screening, and how would that have an impact upon our community? Can I turn that to you, Hema, to answer?
Newborn screening, one of the issues that we've seen, again, as you mentioned, there's over how many, 2,000 mutations. The ones that are tested for are the ones that are supposed to be common, but common to who? That's the question that I have, is common to who? Are we looking at some of the, diverse populations when we look at which ones we're testing for? So there's just very few that are tested for right now, and that needs to be expanded. One of the other signs at birth is meconium ileus. Meconium ileus is a sign and symptom that I want to say 30 years ago when Neeraj was born, he had signs of that, but wasn't really even diagnosed with anything. So the question, then is, are there alarm bells going off when meconium ileus is present in newborns? So who is screened? Those are the things that, with the awareness, I feel like that screening can improve.
Thank you. That is incredible, because that is such a hallmark, meconium ileus. It leads to other diagnoses, like Hai-Sun, when he was talking about trying to have kids, and it was the infertility issue that led to the diagnosis of CF. So there's some hallmark issues that you'd think would lead people down the path. So I am sorry. And I know, Michelle, you have things you want to share about newborn screening.
Yes, and Hema made a great part as far as the the more common, like the Delta F508 mutation being one of those greater than 2,000 variants that's commonly tested for. But it's important to also mention that that's going to be seen in approximately 90% of white people with cystic fibrosis, but not your BIPOC community, your Blacks, Indigenous, and other people of color. So often they are the ones that's more likely to have those rare mutations, as in the case with Terry, 2 rare causing gene variants are commonly called mutations. So it's important to have a clear understanding of that. And one of the things that our organization is advocating for is Terry Wright's law. And what this basically would do is require that all known CF causing gene variants would be used for newborn screening and diagnostic testing for cystic fibrosis. And this would not only help to improve equity in newborn screening for BIPOC individuals, but also help to benefit all people with cystic fibrosis who may have delayed or misdiagnosis due to the presence of rare CF variants. So we're excited about that. And again, having someone like CFRI, in our corner, we know we'll be able to get this pushed through. So
we're going to partner with you to work on that. And it is interesting, in California, there's talk of trying to introduce legislation that would be similar to that, where there would be a quicker path to genetic screening for rare diseases in general. And what I love is in the preparing to gear up, that they're making a clear link to clinical trials. That if you start at the beginning with this genetic screening, that right from the start there'll be this ability to notice who is not being included in clinical trials that now is finally identified, and how that could just change the face of medicine as well. Mm-hmm. Alicia, did you want to jump in?
Yeah, so just to add to what's already been mentioned, which I completely agree with in terms of the newborn screening, is maybe also taking a look at what are the top 10 most prevalent symptoms and adding a screening at that level. So meconium ileus, for example, there should be a screening there for CF. If babies have intestinal blockages, automatically there should be some kind of testing for CF, because we know these are common symptoms. And so let's try to catch it at different levels, not just newborn. If we already know and we have the data that tells us that someone with those symptoms could likely have CF, there should be a mandated screening at that level too.
And I just want to add again, that's why we're so excited about our screening to help identify those common signs and symptoms, so nobody is falling through the cracks. So I'm glad to hear you confirm that.
Mm-hmm.
And yes, to Eliza, we will be, CFRI will doing its part to absolutely keep everybody linked to advocating for Terry Wright's law. So stay tuned. And this is a great segue to the next thing I wanted to talk about. In mentioning Harini, right from the beginning, you mentioned gastroenterologists as being part of this awareness raising because the GI issues are there. And CF, obviously people always think lung disease, but it's so complex. So there are many levels of people entering the medical field that may not be specific to CF, but where they could have an impact. And Jeannie, you are a medical doctor, have been through medical school. So I'm curious to know, because we've talked about as a committee, how to reach out to medical students and what would we want them to know?
So really, I feel like the outreach should not just be to medical students, but to community physicians and from other healthcare practitioners. It should be from the bottom up, top down, and side to side. I mean, really, we should be including community physicians, pulmonologists, general medicine, as Hema said, gastroenterologists, infectious disease specialists. There's and all kinds of other kinds of practitioners. And why is that? Because even, and I speak from experience going to seeing a community pulmonologist just 3 years ago, who I had to go to, somebody knew that they were taught the classic CF is not diagnosed in adults, it's diagnosed in children, and it is occurred in someone in Northern European ancestry. So I had to educate them and tell them, and they thought that, oh, they die of GI disease and malnutrition. And I just said, no, you're a pulmonologist and did not know that lung disease is the primary cause. So I really feel like there's got to be a lot of education in all these different levels. So if not just medical students, but if we are talking about any of them to, conferences that would help relay this information, that when you, to include CF in your differential diagnosis, which is your list of diagnoses when someone presents with, and if you just look at infections, sinus infections, pneumonia, and GI disease, I mean, that's a no-brainer. Go get CF tested. It doesn't matter their age. It doesn't matter their color. It doesn't matter what their heritage is. The other thing, if you go to asthma, I mean, all of us have all talked about asthma, and I myself had refractory asthma that didn't respond to the classic therapies. But if you have asthma that does not respond to all those conventional therapies, to steroid inhalers, CF should be in the differential diagnosis. Asthma that is associated with pneumonia, test for CF. If asthma that is requires steroids, if this person always needs to be on steroids frequently, you've got to think that could be CF. Let's just test it, make sure. And then coughing up blood. I coughed up blood for years, which hemoptysis, and nobody thought it was just, oh yeah, bronchitis, TB. So if someone's coughing up blood and they don't have TB or any other explanation for that, you better think of CF. Then if you go down to GI disease, again, it's kind of the same thing. If they have gut issues that don't respond to conventional therapies or don't even have a real clear diagnosis, you've got to include that in your, include CF in your list of possible tests to do. So now what tests are we talking about? So, sweat chloride, of course, is easy. That's the first line. And then if it's negative, then you go to genetic testing. You just keep going. And if it's positive, of course, you've got it. And then when you think about genetic testing now, it doesn't always, as we've already mentioned, is not always going to show mutations, because a lot of us in different, in people of color, different ethnicities, we have different types of mutations. And I also, one of mine is a very rare mutation that was not detected when genetic testing first came out. That was not one of the top 6 in 1993 when it came out. But docs should need to know that if their genetic testing screen was negative, or even if it showed one mutation, then there's another level of genetic testing that they can have done. So I think, these big areas that are common areas that become uncommon because they don't respond to therapy need to be considered. They may end up be seen by a gastroenterologist, an infectious disease specialist, a pulmonologist, or an asthma and immunology. For me in clinic, in my asthma and immunology clinic, I diagnosed 2 adults. One was 40 and one was 60 with cystic fibrosis. And so, you don't know where people will show up. So we really need to kind of hit the broader community. Again, hitting at the medical student level is great, but that doesn't account for all the community physicians out there who have experience, but who will probably never see, most of them will never see cystic fibrosis. And because of that, they won't think of it. That's my long-winded answer.
My favorite story of the power of the newbie physicians is early on at the CFRI conference, and there was a mother in the support group who was absolutely traumatized. Her son was 11. He had just been diagnosed, and she was on the verge of having her child removed from the home by CPS because they had accused her of abusing him because he kept passing out at school, and he was so skinny. And so they kept thinking it was bad parenting. And literally, he was at school, he passed out. May I also add, lived in Arizona, where it's very hot. So he was having rapid dehydration. And this young, 20-something said, I don't want to overstep, but gosh, I just learned about, dehydration is a thing, and maybe he should be tested. Lo and behold, was tested, and there was no fear of him being removed from the home again. Now, may I also add, that was a white child. So who knows if, this was a family of color, what the outcome would have been there. Would there have been that identification? Would that child have been removed from the home far earlier? We don't know. I mean, these are the societal things, but they are the reality. Because I think of my own diagnosis. I mean, I was told it's reflux. Oh, it's you. Stop nursing her. It must be, she's like, you're one of those rare 1 in a billion moms where the baby can't handle your breast milk. Okay. Then it was, they did a colonoscopy where they identified copious amounts of mucus. Still didn't do a CF test. So, and I think, again, my daughter fits the racial, genetic profile of CF, and that was the longest 5 months of my life. And to know, people are going 50 years and 14 years and 5 years. And as we all know, the damage that is happening at that time without care, it is truly heartbreaking. And I can say this group's on a mission. Jeannie, were you going to say something?
You bring up a really good point, is that the last thing that I should have mentioned was that to the medical community that we're talking to, if your patient does not respond, do not assume, which is what happened in my case, in my sibling's case, that you're not adhering to the therapies. So, I can't tell you how many times I heard, physician, heal thyself, because the doctors I went to just assumed I wasn't, oh, you're being a typical doctor and not taking your medicine. And that was very frustrating because then you have to defend yourself to this unjust accusation. So, if someone's not responding to therapy, don't go there. People don't always take their medicine like they're supposed to. But I think when people start insisting, you've just got to start believing. And if they don't believe, if the patient doesn't believe you, they're going to go somewhere else. That's what I did. I just had to keep going to different doctors.
Can I add something? So I look back in 14 years, if you look at all the signs and symptoms that the more I listen and the more I listen to everybody else, I realize you have signs of meconium ileus. I had to have tubes in his ears because he was constantly getting ear infections. I wonder why. And the ear infections were all connected. He was always sick. He was getting a runny nose all of the time. Talk about the digestive issues. I used to have to drive him in the car to put him to sleep because he had so many pain issues as a baby and we didn't know what it was. And on top of that, you add that then in his early teen years, he was told that he's asthmatic, of course. And so he started with an inhaler. So if you look at all the different signs and symptoms, but the doctors would never put it together and say that this fathoms a test. So the awareness and the signs and symptoms, as Jeannie was saying, there's so many ways. It doesn't have to be at newborn, but the testing needs to expand.
And we do have a question from one of our attendees. How costly is sweat test and genetic testing? Is that part of the hurdle in getting more people tested, or is it mainly based on outdated information? Does anybody want to jump in?
Go ahead, Jeannie. I just want to say that I think it is very cost prohibitive. I wish my sister was here because she was a genetic counselor, but testing for 2,000 mutations in one blood test is very, very costly. And I think, sadly, we live in this world, especially in the US, where everything is cost-based. And I think it would be more effective, and I think this is what's happening, is to have sort of regionalized, statewide genetic testing based on the population in the state. So the genetic tests in Iowa are going to be very different from the ones in California, where we have a higher Latinx population and so on. So adding more of the Latinx mutations to our genetics newborn screening would be more likely to prove to be a benefit. So sadly, the cost is a huge deal. Luckily, the sweat test is a super cheap test. It's a dime a dozen. But some people, especially people of color, might be very borderline on that sweat test. But the genetic testing is expensive. And sadly, I think that will be the biggest barrier to people of color with CF, is to find their genetic mutations in a non-typical screening process.
Did you want to add, Jeannie?
I don't really have much to add, but I feel that if there is the suspicion that this does want to be ruled out, I know I worked at county hospitals, so it was covered for most patients who came through, but also going to a CF center where there are more resources, and at least even if it's just for the testing, once it's on there, once it's being suspected, that and cost is an issue. If insurance is not going to pay for it or they won't get it, then I think heading for some place where there's more resources would be the way to go.
I will say CFRI works really closely with a lot of other rare disease organizations and are part of different rare disease coalitions. And I really think this is where the power of numbers, because there have been all sorts of studies, trillions of dollars in the cost for the diagnostic journey for rare diseases, and then treatment of symptoms with no diagnosis. And so there are more efforts to combine, work together as coalitions to start programs like in California, where there would be a pilot program to put money forward so that they can do the whole genomic sequencing. And can I just say, I just keep thinking it's going to get less and less expensive. More people get in the game. It's going to be the economies of scale. So I'm an optimist that way, but because I do truly believe it's not just for CF, but for these other rare diseases, it's just going to continue as is, with people suffering and huge medical costs as people are trying to figure out what's going on, versus having the test, being diagnosed, and then moving forward and being able to participate in life, have improved quality of life. So, okay, I just looked at the clock, and we have time for one last question, and it's a good one to end with, I think, which is putting it out to ask, and let's see, who shall I ask first? I think I'll ask Isa to jump it off, about what resources are missing for people of color. What should be created and offered to improve awareness and the ability to reach diagnosis?
Thank you, Siri. And I think we've covered some of those, the responses, that access to medical care is huge. Health insurance in our country is huge for people of all racial and ethnic backgrounds, but also socioeconomic. The importance of bilingual material, I mentioned that, not just from the healthcare perspective, but from the nonprofit world, like CFRI producing materials in Hindi and also in Spanish and so on. Even having nonprofits, and I want to sort of take us out of our national effort in the United States and expand outwardly to our global effort. CF exists in every country, and partnering with international organizations, I think, is a very informative way. I learned about CF in Japan through their CF nonprofit organization. I also learned that, and I'm not going to say names here, sometimes drug companies do not want to have their drugs approved in countries where the population of CF is so rare that it's not really marketable. It's not really, it's not worth it. And that's the sad truth of the sort of, the profit orientation. And so I think being able to look beyond numbers in countries like Japan, where literally there's 30 patients identified in the whole country, that we need to be the voice for not just the US people of color, but the global people of color suffering from CF. And also, in a good way, a lot of drug companies have patient assistant programs, but how can we make sure that those programs are accessible to people of color? Are they bilingual? Are our healthcare providers representing the rainbow color of CF patients? Do they speak different languages? That's an issue for all healthcare providers, but even in the CF community, it can be so helpful. I remember a social worker who was a CF provider and bilingual, and after a couple of years, she quit. And the reason she said, oh, well, they didn't need my Spanish, so I went to another field instead of being a CF social worker. But we do need your Spanish. So it's just not as common, for sure. So those are some ideas that I had. And I think, unfortunately, healthcare bias is real, and it exists for people of color across the span, and it exists in the CF world as well. So just all of us, I think, are so brave to be vocal, to let go of shame and perhaps our cultural upbringing around illness, to speak out. If we don't advocate, then there's nothing is going to happen. So if we don't care about this issue, then who else will, is my other thought. And then also, most importantly, I think we touched upon this earlier, is mental health services are always less accessed by people of color. And CF is not just a genetic and medical disease at this point. It is very much affecting mental health as well. And so I want to make sure all people have access to mental health services to cope with the challenge of life itself, but then on top of that, CF.
Any additions from other members of the panel? Thank you, Isa. That was very, very thoughtful.
And can I add one more thing? I do not want to at all say anything negative about drug companies' access to medications for CF people when it's really rare. But I'm wondering another resource that we can advocate for is governmental policies to incentivize companies to either be subsidized or supported in some way to, and I know I'm talking on a global level, to be available in other countries where a disease like CF is so rare.
Absolutely. Anyone else want to add some thoughts? Yes, Alicia.
Yes, I guess in closing, the one thing that in retrospect, when I think about my visits with my young son at that time, who was not yet diagnosed, to his pediatrician, and when the doctor would say, well, I understand all these symptoms that you're discussing and that I'm even seeing, but he seems to be fine. I wish that I had been much more persistent in saying, yes, he seems to be fine, but there's something going on. What can you do to get to the bottom of the diagnosis? And so perhaps, sending his file to other doctors, pulmonologists, gastroenterologists, the variety of care providers that are involved with the different symptoms that he was seeing. So being very proactive and very interested in finding out what the diagnosis is. I guess that's the one thing I would really go back and do differently, is finding a doctor who was super curious and who was going to be relentless and not just let things be, but rather get to the bottom of it. So to me, that's a very important message to get out.
Advocacy has to start from the individual and move its way up. It has to happen on all levels. Thank you, Alicia. And, I just think of Everett, who was in the film, and his story that he had a doctor who was really working really hard, but how was he diagnosed? It was happenstance that somebody overheard and came in and looked at his hands, I'm sure checking for clubbing of the fingernails, so he didn't say that. So, but that is a physician clearly who was trying to find. And so yes, finding the right provider, but also as individuals. And I think that's, a huge part of what we can do is really help people to feel empowered to advocate for themselves and their loved ones and move forward. So I thank each and every one of you for participating on this panel, for sharing your stories, for sharing your time, your expertise, your experience with CFRI to advance our efforts on diversity and inclusion. I thank everybody who attended today, and again want to thank the National Organization of African Americans with CF for being a partner in putting this on, and hopefully people who signed up are going to receive Terry's wonderful coloring book. You'll be receiving that very soon. Thank you to our sponsors, Vertex, Gilead, Genentech, and Chiesi USA for making this possible. And again, my deepest gratitude to this phenomenal committee. So I wish everybody who is here safety and good health. This has been recorded. We will release it in the very near future. And I really hope that everybody will share this far and wide with friends, family, colleagues, so we can keep this awareness growing. So thank you all. Wishing you all well. Bye-bye.